Hey there, this is Alana Miller with ZenPsychiatry.com, and this is my first attempt at video blogging. And I'll be honest with you, it's like almost 6 o'clock right now, and I've spent like 2 hours trying to set up this stupid little webcam and this microphone, and then the lighting is already changed, and then I tried to practice edit little clips, and it was like taking me forever, and I don't want to lose the message of what I want to say in the technicalities, so please forgive the relatively low production quality of this video. I just wanted to get it out to you. This is the first one of what will hopefully be a lot of videos, and I like to write. I'm a fan of the written word. It's probably the method of communication where I feel the most comfortable, but I think there's something special communicated when you can see someone and hear their voice and appreciate their little mannerisms, of which I'm sure I have many. And so, yeah, I am excited to give this a shot, and I hope that this is just another way where you can kind of connect with what I'm saying and the message I'm hopefully communicating. So I had this whole idea of what I wanted to cover in this first little video blog, but I can just tell I'm going to waste a lot of time like editing and reshooting takes if I try to do everything I initially set out. So I'm just going to keep it simple and tell you a little story. About a year ago, it was actually exactly a year ago, October of last year, I was in a break of my chemo. It was between rounds, and I had a really hard summer, like this 8-week course of chemo, and I finally felt I was going to have a chance to catch my breath a little bit. And what happened unexpectedly one evening was I got a rare but relatively serious side effect of one of my medications for nausea. The side effect is called dystonia. You might have heard of it through its more colloquial name, like lockjaw. Essentially what happened over the course of maybe 5 minutes or so is my jaw went from feeling a little shaky to getting progressively tighter and more clenched, to the point where I couldn't open my mouth, I couldn't breathe. It was excruciatingly painful, and it was so tight I was afraid I was going to basically bite through my own face and damage my teeth. And somehow it occurred to me in the moment to wedge my mouth open and shove a towel or a jacket or something in my mouth, and that's how I went to the ER, was with a towel hanging out of my mouth. And I didn't know what was going on at first. The ER doctors didn't know. It took maybe a few hours for them to figure out it was a side effect of this medication. They were working up a low calcium level, tetanus. I guess there's a few things that tend to cause this side effect. And when they did figure out what it was, they gave me the treatment, which is intravenous Benadryl, and it went away within seconds, like 3 seconds. It was instantaneous. And but the few hours that I had this, it was so terrifying that I developed post-traumatic stress-like symptoms afterward. And essentially what post-traumatic stress disorder is a heightened response and a persistent response to a fearful traumatic event where you feel like your life is in jeopardy, or you see someone else be injured or killed, and it just shakes your sense of safety in the world, the sense that you have control, the sense that you can prevent bad things from happening, or that if something bad happens you can do something to stop it. This brief event showed me that I wasn't safe, that I couldn't prevent bad things from happening, that if something bad happened I couldn't necessarily stop it. And I started having panic attacks. I didn't leave my house. I didn't leave the couch, really. Even sitting on the couch, watching TV, which is what I would do. I would just put on some sort of mindless reality TV to distract myself from my own horrible, terrifying thoughts, which was that something like that was going to happen again. And even though this didn't make any logical sense, I wouldn't go anywhere without carrying a little container of liquid Benadryl with me. It didn't make sense because I wasn't even taking this medication. It would have been very unlikely that I got this same side effect again. But it was just kind of like a psychological safety blanket or something. Now, that whole story is not unusual. That happens to people all the time. They have traumatic events. They develop these acute stress-related symptoms. What the position had the unique benefit of being in is I had the past year spent a year working at the Veterans Hospital, the VA hospital, treating PTSD in Iraq, Afghanistan combat vets. So I had seen it from the treatment side, how one processes a trauma like this or a fear response like this and learns how to continue to engage in their day-to-day life. Because that's really what it's about. Bad things happen, we really don't have control, but we find a way to be okay with that, to just trust and have faith that we can go and cross the street and we won't get hit by a car, that we can get on a plane and that it won't crash, that we can put ourselves out there in our relationships and that we won't get rejected, or that if we do, it'll be okay. And the number one thing that you have to do to overcome a trauma is to continue to engage in your life. So what do I mean? After a major stressor or a major, like an earthquake or 9/11, for example, I'm blanking on the word, but like a major event that a bunch of people simultaneously experience that can cause trauma, immediately after, something like 80% of people will have symptoms of PTSD. So PTSD is a normal response to a fearful event. You feel anxious and fearful and angry and afraid, and you have panic attacks, you feel physiologically aroused, your heart pounds, you don't want to go out in situations that remind you of the traumatic event. But what happens in most people, if you go look at those same people who were in the traumatic event 6 months later, only around 30% have PTSD symptoms then. And the reason for that is that post-traumatic stress disorder is not the fearful response to the traumatic event. That's normal. What's pathologic about PTSD, it's a failure of recovery. So people can go down two very different paths out of a traumatic event. They can continue to engage in their life, and even though they're afraid, continue to do the things that they used to do, and then through that relearn that the world is usually a safe place. Or they can get so caught up in the fear that they avoid things that remind them of the trauma. Don't go to crowded places, don't cross a bridge, if whatever the traumatic event, whatever triggers it. And when you avoid, you perpetuate the fear because you're teaching yourself that you can't handle it because you're not trying to. So after I had this dystonia, like less than a week later, I had a plane ticket to go to San Diego to go to this conference. And actually, I was supposed to take the integrative medicine board exam. I'd studied for months. And ultimately, I didn't take the exam. I flew down to San Diego, had just like constant unremitting panic attacks in the hotel room, and then got on a plane and came back and skipped the conference. And it was disappointing, but it was very important to me at the time that I didn't cancel the plane flight. Even though I was very afraid to get on the plane, I was afraid something bad would happen and I wouldn't be able to get help, and I would be stuck or trapped. But I didn't want to give in to that fear. I didn't want to skip the plane flight and then the next plane flight 3 months later have it be much, much worse, because I kind of reinforced in my head that I couldn't handle it. So I made a conscious effort to continue to try to live my life, even though I was deathly afraid. And the symptoms lasted months. For maybe 3 months, I felt constant waves of panic all the time. I was afraid to leave my house. I was afraid to drive. I was afraid to be in an open space. I was afraid to be somewhere where I was not close to a hospital or an ER. I was afraid to be alone. And I just tried to have faith that if I continued to try to engage with life and to take action and do things that were difficult, that I would learn that I would be okay. And that's what ended up happening. It didn't happen in any one moment that I got better, but over the course of months, I stopped having so much panic. After maybe 3 or 4 plane flights, I could get on a plane without crying. And when you go through an experience like that, well, I wouldn't wish a traumatic experience on anybody. But the advantage of having a traumatic experience and then feeling totally broken as a person and then recovering is you learn that you can handle anything. And when you feel confident that you can handle anything, you don't feel like you have to control your environment so much. You don't have to prevent bad things from happening, because whatever happens, you will find a way to deal with it. So trauma is an opportunity in that sense for emotional and spiritual growth. And it sure doesn't feel like it in that moment. But ultimately, if you have something bad happen and you learn how to handle it, you're going to be much more equipped than anyone else who's just had a super easy, squeaky clean life. You're going to be much more equipped to deal with challenges and to try things that may be fearful for you. So I'm going to end it on that note, because I've managed to talk for now a few minutes while not flubbing over my words too much, so I'll quit while I'm ahead. But I hope you enjoyed this first video blog. Please let me know in the comments if there's other topics you would like me to talk about. I have been thinking a lot recently about teaching another workshop on trauma and going over some of the specific tools you can use and exercises you can do to work through kind of this like post-traumatic stress disorder response. Please let me know either through email, comment, or whatever social media if that's something you'd be interested in, because I think I would like to build something like that in the next few weeks. So anyway, I hope you are all having a wonderful day, and I will connect with you again soon. Okay, thank you. Bye.